Recording stopped. Recording in progress.
Let's go to call to order the District Board of Health meeting for Thursday, February 22nd, 2024. And if we could have roll call.
Chair Dare.
Here.
Devin Reese.
Here.
Mary Luz Garcia.
Here.
Dr. Rika Dinko. Absent. Michael Brown.
Here.
Thank you. And John Clacking is absent, and Dr. Novak is absent at the time also.
So
And my name is April Miller, and I will be the recording secretary this morning or afternoon.
Thank you so much.
And we do have a quorum.
Thank you so much. And I heard Dr. Denko is going to try to jump on. The other two will not be joining us, so we'll look for her. Let's go ahead and if we can stand for the Pledge of Allegiance. Mr. Mike Brown, you want to lead us, sir?
I sure can. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we're on to 3, approval of the agenda, but before we just throw an approval out there, I do want to pull 6B2 so Kevin Dick can, our district health district officer can talk a little bit about one of the grants we received. So if someone would please make a motion with that change.
So moved.
I have a first, do I have a second?
Second.
I have a second. Any more discussion? All in favor?
Aye.
Any opposed? That does pass unanimously, and so we're going on to recognitions.
Thank you, Mr. Chairman. I'd like to begin with years of service. Would like to recognize Latricia Lord, Senior Environmental Health Specialist. Latricia, if you could stand up, wave, with 10 years of service in EHS. So thank you very much for your service.
If you're going to clap, you got to clap. Come on. There you go. Good job.
And also recognizing Jackie Chides with her excellent timing, just bopping in, Human Services Support Specialist in CCHS with 20 years of service. So congratulations. Thank you, Jackie.
That's awesome.
We have some new hires that I'd like to have introduced to the board, and I'd like to ask Dr. Dow if you could introduce Sarah Smith. And Sarah's a new EMS coordinator in EPHP.
This is
Good
April.
afternoon.
April Miller. I just wanted to bring attention that Dr. Denko is now present at 1:02 p.m.
Thank you, and welcome.
And Madam Clerk, can I ask, is our iPads working or not working right now? Because I didn't vote on the last item. I voted orally, but normally it would have popped up on the screen.
Yeah, and we went a little too fast, so I went in manually.
Our fault. Sorry about that.
Thank you.
That was a nice way to say I, Jack. I messed it up. Thank you, Susie. Nicely. Back to you.
Thank you. Mr. Chairman, members of the board, for the record, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness, I would like to introduce Ms. Sarah Smith, who joined the EPHP division as our new EMS coordinator. So prior to joining the county, Sarah served as the sports medicine director and head athletic trainer at Bishop Manogue High School. And in that role, she engaged in emergency response and orthopedic medical care for all student athletes. Sarah received her master's degree from Texas Tech University in athletic training and her undergraduate degree at Colorado State University in sports medicine. So in her free time, Sarah spends a lot of time outdoors, often alongside her dog. She's an advocate of bully breeds and local animal adoption. She enjoys the challenges of dog training and every kind of outdoor activities offered by our beautiful region. So welcome, Sarah. So happy to have you on the EMS oversight program.
Welcome. And in no time, you'll be getting a 10-year and a 20-year pin. That's fantastic. Thank you.
Thank you.
All right. Next, I'd like to ask Ms. Lavoie if she could introduce Michael Escobar, who's a new program coordinator in the Office of the District Health Officer.
Good afternoon, members of the board. Rayana Lavoie, Management Analyst for the Office of the District Health Officer's Office, for the record. Mike is our new program coordinator working on the FAB team in the Office of the District Health Officer's Office. Prior to joining us, he worked as a program manager at the Food Bank of Northern Nevada, where he oversaw a variety of food distributions and initiatives across the agency's 90,000 square mile area in Northern Nevada and Eastern California. He engaged with a variety of nonprofits, government organizations, and community partners to accomplish these tasks. Prior to his time in food banking, Mike worked as a middle and high school teacher, fitness instructor, and mixed martial arts instructor. He is also a military veteran, having served in both the U.S. Marine Corps and Nevada Army National Guard. In his free time, he enjoys hiking, weightlifting, martial arts, board games, reading, and shopping at Costco. Please welcome Mike Escobar.
There are days that shopping at Costco is kind of like going to the gym and fighting everybody, huh? It's kind of combo. Welcome. So glad you're here.
All right, next I'd like to move to promotions and recognize and congratulate Erin Myers, who is promoted to Senior Environmental Health Specialist from Environmental Health Specialist in an EHS. So Erin, congratulations on that. We have a number of Washoe County Health Heroes to recognize. We have Carmen Ramirez, who's with our Vital Statistics program, recognized for collaboration, inclusivity, and comprehension, and I think she's busy at work. We have Samantha Beebe with CCHS for adaptability, compassion, and collaboration. And is Samantha with us? No? Okay. We have Jennifer Mendez-Lumas recognized for adaptability, compassion, and collaboration. Tasha Pascal, and I believe Tasha is with us. There she is, recognized for adaptability, compassion, and collaboration. We have Lorena Solario for adaptability, compassion, and collaboration. I don't think Lorena is here. Great. And then Judy Medved Gonzalez, also with CCHS for adaptability, compassion, and collaboration. And I don't see Judy. And Jackie Scheides who is here for adaptability, compassion, and collaboration. So want to thank those employees for their efforts and their recognition and upholding the values of the health district.
Thanks for being a hero. Keep it up.
And then we have a special recognition today, and this is for Kristen DeBraga, along with other members of her team, Ian Check, Gia Bethea, Erin Myers, and Mia Zeb. And we have Molly Rose Lewis from U.S. Senator Rosen's office here to recognize them for their receiving the John J. Guzwick Environmental Public Health Award. And Molly, would you like me to call them up so they can join you up there?
Sure, it would be awkward. Otherwise, I'll have to turn around backwards.
Why don't you guys come on up?
Please do.
Come on.
Hi, everyone. Molly Rose Lewis with Senator Jackie Rosen's office. I'm a regional representative and healthcare manager. And I am here today to present you all with this certificate of special congressional commendation. We only printed one, but we can certainly get some more copies so each of you can have one. And I'm going to read it. On behalf of Senator Rosen, this is a certificate of special congressional recognition presented to Kristen DeBraga and the Northern Nevada Public Health Food Safety Team in recognition of receiving the 2024 John J. Guzwick, if I'm pronouncing that wrong, I'm sorry, Environmental Public Health Award. Thank you for your incredible work to protect the health of our Northern Nevada community. So on behalf of Senator Rosen, please accept this certificate and our appreciation. And please feel free to reach out to my office at any time, and I'm available to help you out if there's anything federal that we can assist with. Yeah, thank you.
Well, don't go far. We're going to take a picture. But
And I believe that Kristen's brought the plaque with her, so maybe she can show. I don't think the board's seen that. Maybe you can show it to them and just tell them a little bit about what it is.
Speech.
Kristen DeBraga, for the record. It's an honor and a surprise, definitely, to receive this award. Definitely want to mention my team and their efforts and how none of this can be accomplished alone, as well as my supervisor, Amber English, for her support and guidance and mentorship. Just very appreciative of everyone here. So thank you so much.
Awesome. Awesome.
And Amber is being modest and just sitting in the back,
she
so
should come
maybe
down
she can
too.
join us, and Rob as well for the pictures.
Mr. Reese, you have something you want to share?
Thank you so much, Mr. Chair. I just want to extend my thanks to this particular team because it's the one that I've gotten to work most closely with. And it's really impressive work that you're doing. You're all of you putting in some very long hours. We don't have as much staff as we would like, so I know you're making do a lot with less. But please know that we see you. The work that you're doing is meaningful. It means a great deal to our community because it really fundamentally impacts the safety of our residents. And I've been out on some of those calls. Ms. Gazeb and I have been out there, and it's hard work too. I mean, I left being exhausted by the work that you're doing. So I thank you really from the bottom of my heart for the work you're doing. And I know this board appreciates all the work that you do. What an incredible honor for Molly Rose to be here from the Senator's office. That tells you that it reaches up to the very highest level. And for that, you have our gratitude. Thank you so much.
Thank you. We're going to come down and join you for a picture now, I believe. So, right?
Yes.
Your favorite part.
You gotta be close because we're all friends. You guys are the important ones. Come this way. Scooch, everyone's scooch this way. Yeah. Keep on coming. Keep on coming. Keep on coming.
All right, that will work. Thank you very much. Here we go. 3, 2, 1. Got it? Thank you. Congratulations.
Let's go to years of service and Latricia.
We got a couple more.
Send them over. Congrats. Thank you. We have some recognitions and some places. Oh. Come on. Okay. She's coming.
Can you tell where that says 10 years?
I have my glasses right here. There you go. Wouldn't that be nice? Yeah, you all know that. Yeah, get in here. And new hires, do we want everybody? We're good.
Let's wait up.
We're good.
All right, here we go. 3, 2, 1. Got it?
Thank you for years. So it's 20 years. Wow.
Michael still
Thank you so much.
Sarah? There she is.
Get in here. Hi. Hello, hi, how are you?
Go. 3, 2, 1. Thank you.
And Aaron, did you want another picture on your promotion?
No.
There, no?
Bust it out.
All right, then we have Health Heroes.
So yeah, help heroes.
Yeah, and Tasha.
You're ready. Come on in, right here.
Well,
Well, we just hope you and Yeah, she's great. Oh, yeah, I can see that.
Okay, we're moving on to public comment because we're on Zoom. Is there anything you guys need to read or say or whatever needs to happen there?
For the record, this is April Miller. All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole and not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Washoe County and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. Please log into the Zoom meeting via the above link and utilize the raise hand feature during any public comment period. To provide public comment via telephone only, press *9 and *6 to mute and unmute. Reasonable efforts will be made to hear all public comment during the meeting. We have no public comment at the time.
Oh, we do have one. Come on down.
Hello, for the record, Molly Rose Lewis with Senator Rosen's office. Again, I just, since I'm here, wanted to briefly give public comment and make sure that you all know to please reach out to me anytime to talk about anything on the federal level or even just anything that's sort of a big deal going on for what you're working on. And so I can report it up to the senator and see if there's anything federal we can do. And then always want to remind everyone, especially folks who may not know about the casework services that we provide with federal agencies. So that could be for a small business or an individual, anything from small business administration loans to the IRS. We're getting, since it's IRS season coming up, we'll be getting plenty of those. But if anyone's having any issues, anything from passports to Social Security to anything like that, please feel free to reach out to me and our office anytime. Just wanted to throw that out there and let you know that we're available. So thanks so much for having me.
Thank you. You are welcome to come at any time, especially smiling. We like people who come in here smiling, so that works out good. Any other public comment at this time? Okay. So we're going to move on to our consent items. We'll go ahead and approve the ones minus the 6B2, unless anybody else wants to pull something else, or do I have a motion?
I have a motion to approve all the items with the exception of 6B2.
Thank you very much. And have a second. All in favor?
Aye.
Aye.
Any opposed? Passed unanimously, and I'm going to hand that over to you. This is the approval of the notice of subaward for the State of Nevada Department of Health and Human Services for a total amount of $333,333 and no cents.
All right, thank you, Chairman. I wanted to make a few comments on this before the board voted on it because we weren't expecting this funding. It's $1 million that Dr. Whitley put in the DHHS budget this past year that's non-categorical funding that he's providing to us. As you'll recall, Joel worked extremely hard during the legislative session to get the Public Health Improvement Fund, but there was no guarantee we were going to get any money out of that. And so he split the $1 million 3 ways between the Southern Nevada Health District and Central Nevada Health District and our health district. And he has this for both years of the biennium. So they were open-ended on what was going to happen with next year's funding, and I can tell you that Dr. Leguen with Southern Nevada Health District was very gracious and agreed to a 3-way split again for next fiscal year. And so, since this is non-categorical, it's really to support what our public health needs are. And so we are, under this grant, are going to be utilizing the funds to help sustain our sexually transmitted investigation staff. That was federal funding that we lost with the clawback of those funds for years 4 and 5 of that 5-year grant. We're also using it to support assessments, so the CCHS division assessment, and then moving on to environmental health, as well as workforce assessment. And then one of the things that we're required to have for our FAB accreditation is a assessment of access to behavioral health and primary care services here in Washoe County. So we're also using this funding to help support that project. So I think this is a good demonstration of why it's important to be able to have some flexible, non-categorical funding. We didn't know we were going to be losing that federal funding, which is really vital for us given our current situation. And so I just wanted the board to be aware of what this is and what we're doing with it, and our thanks to Richard Whitley.
I do want to say, I think it's a testament also to our relationship we have with our health boards across the state, and that we're working together, and that not every state has that, and it's something that we, good job, and kudos to you on that. And because technically it can be based on population base, that's why we're saying it's so good of Southern Nevada to just split it in 3, and we appreciate that. So with that said, the thing we are voting on today is just the acceptance of this, not everything else you shared, but just want to make sure you guys are aware of what we're actually voting on. So with that said, is there anything else that wants to be said? Discussed? Okay. I'm looking for a motion to accept this grant. Thank you so much. I have a first. Second. He beat you to it. And all in favor?
Aye.
Aye. Any opposed? That passes unanimously. Thank you so much. We are moving into, oh yes, thank you for reminding me. Do you have the voting? It doesn't show up on his. It wasn't my fault this time. We're going to go ahead and continue because we went through them. So we're on number 7. Regional Emergency Medical Services Authority, if you'd want to come on down. Mr. Barry Duplantis with REMSA. Good to see you, sir.
Thank you. Good afternoon, Chairman Dare, members of the board. I'm Barry Duplantis, CEO and President of REMSA Health, for the record. I understand that you have been provided with a copy of REMSA Health's January 2024 report. For January and the fiscal year to date, REMSA Health exceeded franchise response compliance with priority calls in all franchise zones, from A all the way through D. We were really pleased with that performance, especially given that we had a couple of winter storms in the month of January that made doing business a little challenging. And also, let me say, in the spirit of smiling events, often our community thinks of REMSA Health in terms of ambulances. And while that is true, EMS service begins with our medically trained dispatchers. For example, in January, one of our dispatchers by the name of Layla assisted a dad to deliver their baby boy at home just 2 minutes after the mom's water broke, and while the ambulance was already in transport. So, as you would expect, this dad assisted in the delivery of his own child. The mom said after, we were extremely fortunate to have such amazing help from Layla as she walked us through the unexpected. So I just wanted to point out that day in and day out, we associate REMSA Health with the ambulances you see on the streets. But the reality is care begins when the phone rings. And I just didn't want that to go unnoticed. And so I thought I'd point that out for you today. Now, sadly, on another note, though, we're now a year past a crash that took place in our care flight organization. So this February 24th at 9:14 p.m., it will mark the 1-year anniversary of the loss of 5 lives aboard our care flight aircraft a year ago. That said, you're invited to join with members of the REMSA Care Flight and REMSA Health team. This Saturday, we will have an event, a remembrance event held at REMSA in our 400 building, where we will remember those lives that were lost, and we'll have a moment of silence at 9:14 p.m. this very Saturday. So you're invited to join us if you're available. To quite candidly share remembrances of those special souls that are not with us anymore.
Thank you for sharing that. You know, when we go through things like this, we do it as a community, and it's something that I know you guys near and dear to what happened with people that work directly for you. But for us, it is a community. So I just take a minute and take a moment of silence, even now, in honor of them, if you don't mind. Thank you. I do want to say one thing that I want to recognize is the leadership of when it's always easy to lead through things when everything's perfect. It's difficult to lead when we walk through difficult moments. So your team has done a great job this last year, walking with your people slowly as they process and they put things together, and even seeing the care flight moving forward, doing things that need to be done. So thank you for the service to that, and thank you for your team.
Thank you. I'm happy to answer any questions you may have with regard to any aspects of the report that I've presented to you today.
Any questions? We do not have any. So we are looking for the acceptance of the report.
Make a motion to accept the report.
I have a first. Do I have a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? That passes unanimously. Thank you so much. Glad you're here.
Thank you.
Moving on to recommendation for appointment to the Air Pollution Control Hearing Board as an at-large committee member. Staff recommends the reappointment of Mr. Phil Schweber for a 3-year term beginning on February 22nd, 2024, and concluding on February 21st, 2027. Oh. Multitasking up here. Thank you. Francisco Vega. What you got, sir?
Yes, sir. Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. So we are recommending Mr. Schweber for reappointment to the Air Pollution Control Hearing Board. Just a little bit of background, because we don't always come in front of you to talk about the Air Pollution Control Hearing Board, but again, it is made up of 7 members who are not employees of the state or any political subdivision. 3 of the 7 members must be designated professionals. 1, for example, must be an attorney admitted to practice law in Nevada. 1 member must be a professional engineer licensed in Nevada, and 1 member must be a licensed general contractor in Nevada as well. Under consent agenda item today, we did reappoint the licensed engineer, and then again here with this recommendation would be an at-large position. As we have over the last probably 3 years, we did an extensive outreach process to try to get applications submitted to us. We did issue a press release back in January. That press release was placed on our website. We also shared that with our email subscription list, which has, I think, north of 3,000, almost maybe 4,000 subscribers. We shared it via social media, and then we also did reach out to the city and county managers so they can mention it during the board meeting. So again, we try to make sure that we put it out there as far and wide as possible to try to get applications. Once you do apply, I did kind of want to mention that once you do apply, you don't get taken off the list. So we are continuously getting applications. And then once we do have an opening, we will reach out to you and let you know that we do have an opening and would you like to be considered for the opening. So prior to this, we had 17 applications. We did reach out to all 17 applicants. We only heard back from 3 of them. That stated that they would like to be considered for the position. So just wanted to mention that. But again, we are recommending Mr. Sweber for reappointment. He has been an extremely valued member of the board. His experience in various air pollution control issues and background in, I believe, Montana on a similar board has been extremely valuable. So again, recommending for Mr. Sweber for reappointment. With that, be happy to answer any questions.
Just a quick question. For those 17 that were automatically in the pool and didn't respond to this call, are they dropped off the list now?
They are not dropped off, so we would reach out to them again when we have another at-large position. We did hear back from, I think, 2 or 3 members that said they just wanted to be removed. Okay. So we did remove those, but for the individuals that we did not hear back from, they will stay in the pool.
Thank you.
Yep.
And I want to say this, a few years ago, we had a big conversation, and part of the reason I really appreciate you explaining all the steps we took is that we probably have really robusted that in the last couple of years and have done a lot better job of reaching out, making sure each of our advisory boards have openings. When they do, we look at them. It doesn't mean we wouldn't reappoint someone who's there if that's the right thing to do, which we did in this case. But anyway, with that said, thank you for all the work and for the transparency, I would say, that you just shared.
Of course.
Good job. Well, we are looking for an approval for the recommendation.
Mr. Chairman, I'd like to thank those that applied and move forward with the recommendation for Mr. Schweber for another 3-year term.
So I have a first and a second. Any more discussion? Seeing none, all in favor?
Aye.
Aye. Any opposed? None. It passed unanimously, and I did push my button.
Thank you.
Presentation. Thank you, Francisco. For presentation and possible acceptance of the FY24 QT Strategic Plan results, Riona Lavoie. Come on down.
Awesome. Thank you. Good afternoon, members of the board. Riona Lavoie, Management Analyst for the Office of the District Health Officer's Office.
We can't really hear you very well. Is that on?
Can you hear me now?
There you go.
Okay. Today I'm going to present the ClearPoint results for quarter 2 for the fiscal year of 24. ClearPoint is our performance management system that we use as a framework to set strategic goals, measure and report our progress, and now we're also in a place where we can use the system as a mechanism to identify opportunities for improvement projects, growth, and learnings within the organization. In your packet, you have 2 reports. You have a status snapshot, which is a high-level overview of the progress that we've achieved within our organization. And then you also have an outcome report, and that will give you more detail about the activities within quarter 2. At the end of both of those reports, there is a legend, and that will help you interpret the information. So let's talk about the activities. As far as our initiatives go, over half of those activities were achieved, and we're only about 30% are off target. Similarly, our outcomes, over half of those are achieved, where we are meeting or exceeding those targets. Our outcomes and our initiatives roll into our division goals. We're about halfway into the fiscal year and making great progress. As you can see, almost 75% of those division goals have been achieved, which leads us to our district goals. about 70% of those district goals are being achieved. At a very high level, if you were to look at the efforts that are off target, some of those efforts have been redirected so that we can catch our new hires up to speed. Otherwise, we're making really good progress. So in addition to all of the accomplishments that our staff has made thus far, you'll also see that we're getting really good at measuring our progress consistently, where we're able to use the system so that we can identify improvement projects, and we're just in a position to be able to use the data to make some decisions. And with that, I'll take any questions that you might have.
Any questions?
I was just hoping to get an update on the office space metric.
Yeah, I do not have that information, but I can certainly ask Aaron, who's overseeing that, and then come back with some more information.
My question for you, is there anything we can do or anything we need to be paying attention to so you can better achieve the goals you set out in front of you?
Yeah, I think that's a great question. Right now, as I was looking through all of our Q2 results, I think right now we're just spending time hiring staff and getting staff up to speed. Otherwise, just support for our staff in that space. But we're making really good progress.
Well, here you go. Here's our support. You have it, 100%. So
you.
Thank you. This is great. And you know what, the thing I like, it's great to have these measurements. And part of it, if you're in the community listening and you're wondering, what happens is sometimes people can get just very neutral in what they do, and we just kind of go forward. But if we challenge ourselves, we're always going to be, you should never have that thing fully green. I mean, that's not how, I mean, your goal is to finish it, but then you come up with new great ideas and say, let's not make it green again. And so I think it's fantastic what you're doing, and it helps us follow along with you. So thank you. Good job.
Thank you.
With that said, this is for possible action. Would anybody like to make a motion, please?
Make a motion to approve as presented. Thank you.
First, do I have a second?
Second.
And the last discussion is great job, everybody. I know it's a whole teamwork. Everyone works on this together. And all in favor?
Aye.
Aye. Any opposed? Looks like it passes unanimously. Okay. Moving on to recommendation to approve the fiscal year 2024-2025 budget. And this is all you, Mr. Dick.
All right. Thank you, Mr. Chairman. And great. I've got a slide deck that I'd like to run through to present the budget to you. I want to acknowledge all the hard work that's gone into this, with that being led by Mr. Jack Zentino and his team, Administrative Health Services, the division directors, all working in collaboration, and us all working together to reach consensus about how to move forward and what's proposed in the budget. As you'll recall, we did talk about the budget during our strategic planning session, and kind of the uncharted territory that we're in right now with the ending fund balance that we have available, but knowing that COVID funding is going to be going away. We've got a federal government. We don't know if it's even going to be open for a little while. We've got uncertainties ahead as far as the state's investment in public health. And so all of these are variables that we need to be considering as we move forward. So thank you for the next slide. We have a budget to support our mission of improving and protecting our community's quality of life and increasing equitable opportunities for better health. And the next slide, please, to support all the different things that we do for public health in our community. Next slide. In the staff report, we have an extensive list of accomplishments over the past year. I just wanted to highlight a few. Our name change to Northern Nevada Public Health was a big lift. We finalized and began implementing the 2022 to 25 Community Health Improvement Plan. We finalized the Health Equity Organizational Capacity Assessment and Plan. And we've got the first year of working on those initiatives under our belt. We have completed the project for the new counter area and reconfiguration for community and clinical health services, and improved some process efficiencies over there. We've created that new active managerial control program for food safety. we've created the Washoe County EMS Strategic Plan along with our EMS partners to guide us over a 5-year period. Air quality achieved a 96% data capture rate for all criteria pollutants. And we have also worked in EPHP and along with EHS on training and expanding staff capacity for outbreaks and top reportable communicable disease cases. So next slide, please. Our staffing is key, excuse me, to be able to accomplish all these program areas. And so what we're proposing in the budget is 201.49 full-time equivalent staff for the health district, 185 full-time, 6 part-time. Those part-time staff include APRNs, public health nurses, and our government affairs liaison. Actually, we'll be moving that government affairs liaison up to full-time. And we have approximately 56 temporary staff that are APRNs, registered nurses, registered dietitians, public service interns, and I believe some community health aides. The next slide is our org chart, which I think you're familiar with. Tough to see on this screen, but our 4 divisions, Administrative Health Services Office and the offices of the District Health Officer. It shows how those program areas and FTE are distributed. Next slide, please. And these are all the different programs that we provide to the community. A few of these in EHS are now rolled up into a consolidated budget area. And so those budgets are included as one of the appendices to your report that shows you what the proposed budget looks like across the different program areas that we address. Next slide. So the above base requests that we have for FY25, all of the positions, and these are tough to see. I'm going to run through them by division so you can see them. But we have a number of positions in CCHS that are grant-funded positions, and with the salary increases that we experienced through the county's Corn Ferry classification review, we have $222,179 of salary costs that we're unable to absorb with the grant funding that we receive for those programs. So across all the grants that we receive at the Health District, we've worked hard to see how can we readjust budgets, or are there other things that we can cut out of the grants to accommodate salaries. These are the ones that we just can't cover. And so the budget that we're proposing requests an increase in the general fund transfer from the county for this amount of $222,179. And I think this is a token increase that we're requesting. We've had stable flat funding in our general fund transfer from the county since fiscal year 2019. And we've had actually decline in funding that we've received from the county since fiscal year 2016, when we received a little over $10 million from the county. The reason for the decline was in December of 2015, the board increased our fees, which was an important move for the board. And part of what we incorporated in the fees was the overhead costs that the county had begun charging us for. And so because we were recouping some of that overhead cost, we offered to provide that back to the county since they had helped to subsidize us after they imposed those costs on us. And then, so that was a 50% increase that happened in fiscal year 2016, and then another, the remainder, the full 100% of those fee increases went into effect in FY 2017. As we got the next 50% of the fees coming in, that's when it was reduced to $9,600,000 $100,000 or so of the transfer. So we've been really flat as far as having any increase from the county for quite a long period of time. The other increases above the base are to take a business technologist position that's currently grant funded in EPHP that's really critical to the health district, and to move that into administrative health services as a local funded position. We are proposing to have a couple of job classifications changed in administrative health services. So these are being submitted to JEC, the Job Evaluation Committee of the county. And one is to have a fiscal compliance officer changed to a public health fiscal officer with a salary increase involved with that. One is to have a account clerk 2 changed to a principal account clerk, which also has a salary increase. In EHS, we're proposing to reclassify administrative assistant 2 to a senior office specialist. Gets a little bit of savings out of that. In environmental health, also looking to add an environmental health specialist. And we need to shift some of our underground storage tank program costs to local funding that weren't properly covered in the budget previously. And in my office, I mentioned increasing the hours, weekly hours for our government affairs liaison. And in environmental and public health preparedness, we're proposing a new statistics and informatics supervisor, and that's to address span of control issues, as well as wanting to expand and improve our work in informatics. Southern Nevada Health District actually has a pretty substantial informatics staff. This is about taking lots and lots of data that we have at the health district and presenting it as information that people can process and make decisions with, and to better inform our community. So that totals a little over $700,000. As I mentioned, a big chunk of that, the $222,000, is the Corn Ferry increases. We have basically just two new positions, one position that we're moving off grants to local, and others that we're making adjustments to as far as reclassifications. So next slide, please. Actually, I want you to go ahead. Another slide I'm going to run through by division. What this looks like, and so to begin with my office, we have 14 full-time equivalents. We have our revenues of a little over $10 million, and about $10 million of that is the funding that we have for the new TB clinic. So that shows up in the budget under Office of District Health Officer. Our expenditures of $12,830,000. And as I mentioned, our above base request is to increase the hours for our government affairs liaison position, which has been part-time. And then for administrative health services, 10 full-time equivalents, program expenditures of just under $2 million, and those reclassification requests that we have for the fiscal compliance officer and the account clerk 2 to those other positions, and then moving that business technologist position off grant over to them. For air quality management, we aren't proposing any additional staffing at this time. We have program revenues of about $4.4 million and expenditures of a little over $4.5 million in air quality. For community and clinical health services, our largest division, 83.7 full-time equivalents, revenues of $5.325 million, and total program expenditures of a little under 12 million. It's just those above base requests that we're making the general fund request to the county for the salary cost of the positions we can't cover under the grants. For environmental health services, we are proposing to Add that additional environmental health specialist, that would bring the full-time positions to 48.39. We have about 6.6 million in program revenues and about a little under 9.3 in program expenditures. We're also looking for some savings on reclassifying the administrative assistant 2 to a senior office specialist. That position is currently vacant. And then shifting those underground storage tank costs as we need to true up the budget. For epidemiology and public health preparedness, the proposal to add that statistics and informatics supervisor, that would be 23 full-time equivalents, and program revenue there is about 3.385 million, expenditures of 4.268 million for that division. So I think we've gone through a process in coming up with our budget and our proposal to you that began, as I mentioned, back with our strategic planning meeting, looking at community needs and community health assessment, looking at organizational capacity and the work that we've done in assessing our organizational capacity, looking at the foundational public health services and where we have gaps, in looking at the work that's been done nationally on where staffing should be, considered input that we've had from the Board of Health, staff and community stakeholders, and then trying to be pragmatic given the budget consideration that we have, to look at operational and financial stability post-COVID-19 and our Korn Ferry classification and compensation study impacts. So next slide, please. Next slide after this. We're going to run through the sources and use summary. Very difficult to see on this screen, but what we are proposing with the budget that we have for revenues. Well, first of all, let me start with we're projecting an ending fund balance of $13,645,586 at the end of this fiscal year. That is projecting $5.23 million of deficit spending, and would give us a fund balance of about 34%. I think that this is probably I think it's a very conservative estimate. Historically, we have not come in hitting the number of what we expect to spend, and we've been several $1 million under that. So I would expect our ending fund balance to be higher than this. If you look at the previous year for FY23, we had an increase of $710,000 to our end fund balance when we were looking at a budget where we had projected, I think, about $2.5 million deficit. But rolling that fund balance to $13,645,586 into the budget, looking at revenues coming in between grants and fees and other charges of just under $30 million, we would have those revenues $29,898,737. The county general fund transfer with that $222,000 increase would be the $9,739,035 to bring us total revenue and general fund transfer $39,727,000. Total sources of funds with the ending fund balance added in $53,373,000. When we look at then a flat budget without the above base request, our expenditures would be coming in at $43,852,711. So that would be a deficit budget of $4.125 million. With the above base request, the revenue side, total sources of funds remains the same. We increased the budget to $44,600,000. Our deficit goes up to a little bit under $5 million. We'd end the year with $8,773,164. So that'd be about 19.7% fund balance. So as I mentioned, we don't really trust that we're going to have that $5.23 million of expenditures occurring through the rest of the year. That would be reducing our fund balance to that $13 million. So I expect that we actually have a better scenario than what this looks like. But with those positions, the two positions that are new that we'd be adding, we'll be looking at how we come through the end of this fiscal year, what that fund balance looks like, to be assessing that before we dive in on adding those positions. Now, I've had questions about our COVID staffing, and what are we trying to maintain all of the COVID staffing and that sort of thing. So we've looked at that, and in CCHS prior to COVID, we had 8 per diem RNs, and we increased that in COVID to 32. So that was an increase of 24 nurses that we brought on. We've dropped down to 14 at this point. Our per diem community health aides, we added 9 to help with our testing and vaccinations, and we're now down to 2. In temp staff, we added 119 positions, and we're down now to 39. So if you look at all of those, the per diem and the temporary staff, we ramped up with 152 positions. We're now down to 47. I would add that we had previously our COVID-19 funding was going to run out July of 2024. And now they've extended that a couple of years. So I think we were just maintaining some people until we came to the end of that funding. I think we'll be working to further reduce the staffing that we have in those temporary positions moving forward. The other piece of the puzzle with COVID-19 is that we did add 11 regular Washoe County employee positions with the COVID-19 funding that we had, and that was critical for us to be able to manage the temp staff we brought on and those types of things. But of those 11 staff, we're now down to only 3 that we still have in the budget. So, and again, we have now more time for attrition on some of those with the extension on the COVID grant. So we're not attempting to carry all of the capacity that we built with COVID-19. As we get some of the public health improvement funds, that $1.2 million that we'll have for next year, I think we will be looking to see how can we maintain some of that top professional capacity that we have in epidemiology and public health preparedness. So to go to the next slide, on the revenue, this is a pie chart that just lets you see what the revenue looks like. The red piece of the pie is much bigger than normal because we're still seeing those COVID grant funds, the ARPA funding that we've got for the $10 million for the TB clinic, that's skewing that number larger than the 25% or so of the budget that we've seen historically. The licenses and permits are covering over $5 million, 13.2% of our budget. The general fund support that we're requesting would be 24.5% of our budget. So those are the big pieces. Charges for services, also a good piece of the budget, 7.7%. So I think it's important to look at where we can bring in those funds with the licenses and permits, the DUS plan, birth and death certificates, charges for services are all adding up to be a good piece of our budget. And so I commend the board for your decisions to stay on top of that and recoup the revenue that's available to us from charging to recover our costs for those services. And the next slide. So this is the slide that then shows what does it look like as we project out into future years. And so with the proposed above the base budget, we would have an ending fund balance at the end of FY25 of $8,773,163,000. Projecting that forward, the budget for the next year would come in at about 5.357 million dollars of deficit spending, and would come in at $3,416,000 of end fund balance. That's about 9.4% fund balance. Now, I mentioned we expect we're probably going to come in higher with our ending fund balance from year to year. You add $2 million to our ending fund balance, that brings it up to about 15% for an ending fund balance. But if we go at the worst case scenario with these projections, then we would have a little over $6 million of deficit spending in FY27, and that's when we would actually be negative with our budget. So I presented budgets for several years. The budget accounting system makes it look like we're going to spend more than I think we really will. The budget is based on all of our positions being filled 100% throughout the year. So the numbers always look worse than I think that we're going to end up with. But I would ask you to consider and the approach we took on this budget, the fact that we're really not trying to add a lot, but some places where we think that we need it, and approve this budget knowing we're going to be watching carefully what happens with the budget and where we end up with our ending fund balance. I think we do have places we can adjust if we need to as we move forward. So the next slide, we always, because of our process with the District Board of Health needing to approve our budget and then needing to take it to the county and have the county commissioners also approve the general fund transfer in our budget, we have to start early with this. So in March, I will have a meeting with the county manager and the city managers on the 11th to present the budget to them, as is required under the interlocal agreement, and discuss it with them. And I will bring you back an update at the March Board of Health meeting on what occurred with that discussion and what thoughts were. In April, the Board of County Commissioners will be meeting, and the county manager will make his recommended FY24 budget to them. And that's when general fund support, we should see what is being proposed and have a good idea of whether they're going to work with us on that increase. May will be the public hearing with the Board of County Commissioners where they adopt the budget, and then the county will deliver their final budget to Department of Taxation June 1st. So I guess I'm also acknowledging that, the way this process works, while the board approves the budget at the meeting here in February, there may be adjustments to the budget that occur as we go through this process, but it, I think, provides us a sound foundation, and they're not huge. They're adjustments we need to make as we work with the county and work through this. So that concludes my presentation. Hope I wasn't overly long, but happy to take any questions. No,
you actually did a good job in the details you gave, so I appreciate it. But let's go ahead and open it for discussion, and I'll share last some of my things. But Mr. Reese, you have something you want to share or ask?
Sure. Maybe let's start out with the general statement. I appreciate all the work that's gone into building the budget. I think it's a difficult task to do for any organization, especially one of this size. And when you layer the complexities of the county's role in being a primary funding source, and then you add on that we are all from other bodies at times onto this board, and a group of folks who are also volunteering in the service, it can be very difficult to be accessible, right? So that is a credit to you for breaking it down into its component parts. For my part, I view my role here maybe differently than I would back at my home jurisdiction, meaning at our home jurisdiction, I might have like 12, 13, a dozen, I don't know, 42 meetings about the budget, and we would have the ability as individual council members to very much tinker with the minutia. I don't feel like that's the case here, nor do I think that that's necessarily my role. So I have more broad questions. The first one is really about the Corn Ferry study, and I want to say thank you to Mr. Dick, and also to Marluz Garcia, and for your staff for working through some of the complexities that occurred with one particular group. They came and spoke to us, I think, in the December meeting, as I recall. And for my part, I think that we got like 90% of the way there. I don't think it fixed everything for every single individual person. I'm not sure it ever was able to or was designed to. But maybe I would stop and just pause there on that. So the Corn Ferry study has resulted in some fairly significant budgetary impacts. And I also know that the role that my colleague to my left played in making sure that some of the issues, which I found very difficult, were fixed. And so as we move forward, how do we as an organization make sure that we are, and I'm so sorry, the mic is going in and out on me, how do we make sure that we are creating a budget that is both resilient from a purely budgetary standpoint, but also honors the commitment we've made to our employees, the folks who are doing the good work? I worry that sometimes in the minutia, it's lost that all of these numbers relate to certain people and specific groups within the larger district, Northern Nevada Public Health. So I'm sort of asking a general question, and maybe that'll allow us to have a more specific questions answered after that. So I'm looking to you, Mr. Dick, about that, if I've explained my question.
All right, let me take a crack at that. It was a little general, but I think I got
it. It's general, but I think you and I have had conversations that'll help guide our conversation.
Yeah, let me start with the pay inequity issue that was raised by some of our staff at the previous meeting. And we coined the term leapfrogging for that, in which somebody that has not been on staff as long in the same position ended up with a higher salary than somebody else that had been here longer because of the way the implementation rolled out and the data of it and those types of things. And with Commissioner Garcia's support and working with the county manager and HR, we were able to develop a path forward to address those salaries. And we've been able to do that within the health district, so that there's no more of that inequity where somebody is making more than somebody that has been here longer in that same position. That was, we kind of had to hit a sweet spot with how the adjustments were made, because the thing with the Corn Ferry and all these salaries is, anytime you change one piece of it, it's like throwing a rock in the pond, and the ripples go out from that, and now you've got other unintended consequences going on. So we were able to implement an approach where we were able to make it so that nobody was leapfrogged, but we didn't create more leapfrogging issues in that process. So I think we were successful in the way we addressed that, and I think staff were pleased to see that we were able to address that and correct the inequity that was occurring. As far as overall, with the Corn Ferry implementation, we see a significant increase in our salary costs. And so if you look at salary and wages, going from just under 15 million, 14,778,79 last fiscal year, to almost 17 million in our estimate to complete for this fiscal year. Now, the ongoing impacts of the Corn Ferry salary adjustments are that most of the ranges were extended further for the upper end of the range than they had been. And so in future years, we'll be seeing a merit increase impacting us, where staff under their collective bargaining agreements are to be provided a 5 million or a 5% merit increase if they meet their performance standards. And so that's a cost that we've incorporated into our projections for the future with the budget. I think it's going to be imperative that the county recognizes this ongoing cost to the health district and helps us with the general fund transfer as we move forward. We're starting with the nominal number of just what we can't cover with the grants this year, because we're still sitting on a fund balance that's fairly significant. But having those discussions with the county manager and trying to lay a foundation for that investment in the future for the health district.
Mr. Chair. Mr. Rick, I appreciate the response. I suppose I want to make sure that I convey to you and the other departmental leaders that I view the Corn Ferry study as a necessary component of moving forward as an organization, because it really spoke to a broader question about whether we were underpaying our employees, which I think it proved that we were, not by a fault, but it's like inertia that drives it forward as year after year passes by. So I think the Corn Ferry study is a moment in time to draw a line, and then the question is, how do we get better, right? How do we resolve some of the inequities? Because I do think there are still people for which the entirety of the thing was nearly made up, but there are still people that are within, a year or so of either side of colleagues above or below them that are perhaps did not receive what they anticipated they were going to receive through the different kinds of increases that were contractually baked in. And so I think we may not have fixed everything in this one fell swoop. My hope is that as we move forward, we will fix it, which leads to the sort of the second question you've identified. And this slide that is called the impact of proposed budget on future fund balance. This is the one that is alarming to me. This is the one that speaks to a broader concern, because ultimately, either A, we don't have a balanced budget because we're balancing the next year's on the ending fund transfers or rating the fund balance, or we have some systemic, unsustainable future ahead. And so I suppose it behooves us all to take back to our jurisdictions, especially my dear friend, Commissioner Mary Luz Garcia, this question of how do we right-size the ship, because it worries me when I see the end fund balance really being used to cover expenditures in the way that it is. It's nothing that you have done. It is systemically been created by the organization's growth, its overhead, and the increasing complexities of a health district, which I think, even at my very surface level, I'm beginning to understand how diverse and complex the various range of divisions is or are. And so how, without the county's support, at some point in time, we don't have a fund balance and we hit the negative, and then we're talking about drastic concerns. So what is the path forward to a more sustainable budget?
Well, that's an excellent question.
But he's going to be retired, so he's all, I don't know.
So we're kind of stuck between a rock and a hard place in some respects, because as long as we're maintaining a significant fund balance, we are not going to be able to have the county decide that they need to provide us with more general fund support. So we do need to spend down the fund balance to be able to be in a position where we're being able to show the need for a county transfer to support the health district, as we're going to need to have in the future. I think we're also, remember, working to pursue a strategy with the state to invest in public health. And we have, the foot in the door with the initial investment in the Public Health Improvement Fund. I'm encouraged that the governor in his 3-year plan included one of his items, and there were not a whole lot of items in that plan, but one of them was dedicated funding for public health services. So we'll continue to work to try to develop state support for us. But I think we're in a place where we need to continue with the spending. It's not a big investment that we're proposing here with what we've got. It's spending down the fund balance, but I don't see a place that's ripe for us to be cutting services that we need in this community.
So let me just tag on to that for a moment. I know there might be some more questions. As I look at this, I definitely see that I think we really need to dance with this. And what I mean by that is I do think this year will need to play out. And I don't think that all of it sits on one group. I don't think the county just is the answer or the state's just the answer. I think we're still trying to determine what post-COVID looks like for us and inflation looks like for us. And so there's like so many unknown components that we need to walk in. I do agree, and I support very much for us to go to the county this time and ask for just some. There's nothing wrong with us bringing down our ending fund balance to a place that it is fine. But if I don't want anybody to be surprised, so it's good we're having this conversation now. So in the future, there's no surprises to our state, to our cities, our county, of hey, wait a minute, so no one is being irresponsible by saying in 2 years we can't keep doing this. So 3 years from now we're in trouble if we keep doing exactly what we're doing. So with that said, I think it's going to be imperative with the new health district officer that comes in that we make some very strategic plans of how they see this rolling out. And I'm excited to do that with whoever that might be. And so as that flows, but I think a dancing with that, and I really think you brought it to a good place where we can, we're good, we're not in desperate mode right now. I do question, and I say this with respect to every employee we have, is everyone that we have hired, we still have more hired than we did before COVID. And looking at that, that's something that we all, our deputy directors need to look at. We all have to really look at and say, are we bigger because because we were bigger and we like everybody, or is we bigger because of need? Are we in a new time and era where health district needs to be the size it is? And these are all the kind of questions that we don't know the answers to, because I don't question that everyone's out there working, but it comes down to, like we've always said, are we doing a job somebody else could be doing? So those kind of things have to be asked. But I think it's a fair conversation. I do think for this year, looking at this, it doesn't worry me to bring that down, because I don't know that anybody's really going to talk to us if we have the ending fund balance that we have. So, do you have anything you want to share?
No, great job.
Go ahead, sir.
Thank you, Mr. Chair. For my part, I think the concern I have about rating the ending fund balance, or who views it as being like, I don't know, the piggy bank to be rated, is that we've just survived a global pandemic in which every resource that we could possibly bring to bear has been brought to bear. And even then, I think there were things that we could have done differently or better. So for my part, this organization having had the foresight and ability to create an ending fund balance is, I think, due to their good budgetary planning. Whether it looks unattractive to others, I'll leave that to be decided another date. But as this slide shows, it really is concerning, because we get into, I guess we're 3 years away from really not having that cushion that we've had. And so, and as for the largesse of the organization, having looked at the organization chart and studied each of the divisions, my worry is that we don't have enough staff, not that we have too many. I look at a number of our divisions where they're really struggling because we're really pressing hard on our people, and we've had some turnover that's related to that. So wherever we get to is going to be largely based on how we work with the county and the two cities to figure out how are we going to support the efforts of this organization? Because ultimately, there are things that we're doing very well, but there are also areas where we're stretched so very thin from a human capital standpoint. I'm just not sure it's sustainable long term. I also look at, this hand-wringing that we did over the funds that the federal government, I can't remember if it was the federal or the state government, who clawed some of the funds back that we really were counting on in the area of sexually health and sexually transmitted diseases, and to have gone out and found some ways to kind of Band-Aid it back together really speaks to the quality of our lobbying team in Carson, our directors who fought for it, the people who write grants, all those things. It's very hard to see us running leaner than we are, given what we know about the complexities. And of course, I think we all believe fundamentally that health crises will come. It is an inevitability. The question is, how do we deal with that, and how do we better prepare for it? So I think there are lots of, we're speaking now more in generalities. I was hoping not to be so general, but it's just hard because it's hard to know where into the budget to grab onto. And so again, for my part, I'll just say that as a member of this body, I want us to invest in our human resource capacity, our people. And we've got some, I know we have some capital projects that are not even represented by some of this. I know we have a transition going through here in the next several months, but we have a duty first and foremost to the public to provide for the important things that we do, whether it's air quality or vaccinations, but we also have a duty to our people. So.
And I think you hit on some very good points that I wouldn't even disagree with. I just think there's some unknowns in some of them. But the one thing I actually do agree with hugely is that how can we prepare ourselves to be prepared for something that might come if anything like we just went through. And now obviously you can't prepare for the unexpected, but we can do a little bit better than maybe we had. And so I appreciate us looking forward and not trying to act like, oh, we're done. We're just moving forward. Everything is whatever. Things have changed, and we look at things differently now. So, Ms. Garcia, do you want to see it? Good. Okay. Well, with that said, we do get to vote on this fun thing and accept it or not accept it. So, are we willing to go forward? That includes the ask to the county. I do want to just purposely put on the record, we have a great relationship with your county. We love working. It's really not anything of a thing. And I know it's kind of puts you in a spot, kind of being on this board and both trying to figure out, but you're a good representative. You can explain it. I even think working with Eric Brown's fantastic. And I think you guys will find the right answers, and then we'll deal with the answers as they come. So whatever that looks like, we understand. But we do want to make sure that no one's surprised by what we're seeing is the biggest thing. With that said, I am looking for a motion.
Mr. Chairman, other than the ongoing communications with the county, I'm happy to move forward. There's no formal adjustments from this discussion that I heard, correct?
There's no formal
adjustments.
Agreeing to this, yeah. All this means is this is our ask.
Yeah.
Yeah.
Well, with that, I move to approve Northern Nevada Public Health's fiscal year 2025 budget as outlined by staff.
Thank you. I have a first and a second. Any more discussion? Seeing none, all in favor?
Aye.
Aye. Any opposed?
Aye.
Very good. Now I want to say to staff, great job. There are so many moving parts on this. It is crazy. And we do budgets all the time on different things, but this one actually caused my brain, and you know what happened to my brain recently, to bounce around a little bit. It was pretty fun to watch. So with that said, thank you very much. Okay, we're moving on to 11, presentation, discussion, and possible adoption of Northern Nevada Public Health Policy on Relationship in the Workplace. And I'm going to talk about this one just a minute. Sorry about that. Thank you. This is something that I asked for. It's something that we have in many other things that I function with, and I think it's a wise thing. And the policy has been drafted to help us move forward. One of the things our job is to help make sure we can have proper investment into leadership, future leadership, and it's very difficult to do that sometimes when we have married couples working right next to each other and then one cannot be their boss. That means we have to go find somebody else to come over, be the boss over them, and just all the different things that go with it. So we just wanted to put together something that's a little bit more formal and kind of keeps an eye on that in a closer scope. I'm open to any conversation on it. We did work with HR on this. We did work with, kind of went through the gamut of back and forth and talking, but I think it's just a make sense policy to help protect our employees in the sense of making sure that they can let work be work and home and all that good stuff, but also protect us that we can move forward in a proper way. So with that said, if there's anything you want to add, Mr. Dick, you good? Did I say it good enough? Any questions, concerns, thoughts? Or a motion?
Mr. Chair, what is the impetus for this policy? What was there something that I'm not aware of? Is there something?
No, right now I think the began with someone just the understanding as we watch some of the different things going on. But when we look at succession planning, we found ourselves in a place where we have wonderful people who should be able to step forward into leadership positions, but they can't potentially because their husband or wife works next to them. You can't lead over their significant other. And so it puts us in interesting places. So it's good leadership. It's something that I think our city has a thing where you actually have a group you go to, and it's a community group of peers that help make a decision. And that's kind of what we've set up here, is that idea, and it leaves the district, each of the directors in place so they can be a part of that as well, of watching how it's going. It doesn't mean, we have husband and wives that do work in the city. We do have father-sons that work in the city, but they don't ever work so close that we have to worry about one being in charge of the other. So it's just a future. To me, it's structure. I'm a structure guy. So it really, as I see things that need structure fixes, I try to fix them.
I can add one other thing.
Sure.
I just wanted to share that we did provide this to the Washoe County Employees Association. They reviewed it and they were not opposed. They were not opposed to it. So.
That was going to be my question. And also, if who was involved in drafting the policy?
Ms. Dixon took the lead. It was the chair's request. I'm sorry. Ms. Dixon took the lead. It was the chairman's request. We shared it with the division directors, got input from them. Also was shared with HR and legal counsel. I can tell you they weren't, there was some wishy-washy around guidelines, but the chair's position was the board should set policy for the health department. The Employees Association, when they reviewed it, noted that other departments also have some processes and procedures that are stricter than HR's. So.
Yeah, because the rule for us is we can't be less strict than Washoe County, but we can create our own within. And like I said, to me, it's actually, like I said, it's anywhere that I'm the chair of at this moment. We have things just like this. So to not have it was, I'm not sure why we didn't have it before, but I think it could have been just because I heard a little bit in the past, some of the county commissioners liked the idea that they didn't like that conversation, so it didn't pass down into the health department at the time. And so for me, like I said, just even, imagine you and your significant others there, you want to go for an increase in merit and raise, and we say, sorry, you can't. It's protecting everybody. It's just a structure piece. It's how I look at it. Any other question? Do I have a motion on it?
Move to adopt the Northern Nevada Public Health Policy on Relationships in the Workplace.
I do have a first. Do I have a second?
Second.
And any more discussion? All in favor?
Aye.
Any opposed? Passes unanimously. And I say this to any staff that may have any questions on it, please reach out. We want to make sure we're very clear, concise, and those who are working for us now that are married, congratulations to you and all that good stuff, and we want to support you and see you become all that you can be. So make sure if there's any questions, you talk to Mr. Dick, and we are here to help and guide. Okay, with that said, we're moving on to 12. Progress update on the District Health Officer National Search. And I just want to tell you guys, I think we've been communicating, but I'll make sure everyone knows what's going on. Next week, we do have our via Zoom team meetings. We have 8, I think, wonderful, quick potential candidates to sit in this chair right here. I think that it's all going well. Our search committee, they found quite a few people. And they've done a great job. I've been very pleased with the organization skills and everything that's happening. Next week, we will be walking through that. We'll get down to where we have 2 or 3 that we will bring in front of this board in March, and there'll be a decision made at that point by our board. It'll be a majority of the board. And I can tell you from the little bit I've seen of, I think we have some great candidates. And do you want to speak to any of that, Mr. Dick? You've been a part.
I would just agree. I was pleased to see the slate of candidates that were presented. I think we're in agreement on with the search firm on which ones merited the follow-up with an interview, which ones were not the A-list for us. And So I think they've done a good job, and we're well positioned moving forward.
And officially to say for Ms. Reed, so you know, everything we purposely have done is made sure we don't have quorum. We're no walking quorums, no quorums, no anything of that fashion. What we bring to everybody will be a fresh look, and we'll have a fresh decision to be made. Okay? Yes.
Can I just ask, these are, did you say we're doing them by Zoom? Or the candidates are coming by Zoom?
The first 8 we will, but then when it comes to the ones we will look to hire, they'll be here in person.
Understand.
In
So,
March.
but I have on my calendar, it's the administrative conference room. Is that just a placeholder? Meaning I can be at Zoom at my home? Or
The intention is for the candidates to be virtual on Teams or Zoom, and the committee, the panel would be
In person.
At the administrative conference.
In person.
Okay.
Gotcha. Okay. That is just an update. We're on to air quality management. Come on down. Francisco Vega.
Thank you again, Chair, members of the board. For the record, Francisco Vega, Director of Air Quality. Just a couple of things I wanted to highlight in my report and also mention under the consent agenda item today, we did have the supplemental environmental project that we completed with De Loretto Construction. Really enjoyed working with them and finding some value for the community. So we'll continue to look for these opportunities. That's something that I've committed to since I've been the director is find ways to, again, provide value for the community. And this was just one example where we were able to work with this company and get some electric vehicle charging infrastructure at one of their, well, this one was Liberty Dog project. But again, those are the things that we're looking for, and we'll continue to do so. So thank you for that. In my update this month, there was a lot of information regarding the National Ambient Air Quality Standards, lots of moving parts. For the PM NACs, I will provide another update next month, but essentially what that is going to look like is EPA has lowered the ambient air quality standard for particulate matter, and I'll provide more information next month because that was just recently decided. On ozone, I had previously stated that EPA was going to conduct a new review of the ozone national ambient air quality standards, so that is progressing as well, and what they've done is they've remanded that 2020 decision. So that kind of allows them to start that process now. And then for nitrous oxides as well, is they've selected the panel that's going to review that pollutant as well. So a lot happening in regards to national ambient air quality standards. And again, that's what kind of drives everything that we do in air quality. So one of the commitments that I've made to the board is that I will keep you apprised of what happens with these standards. I think that's it for my update, but I'd be happy to answer any kind of questions.
Thank you so much. And I did see some of your stuff you're trying to do for the larger grant piece. Do you want to say anything about that?
Yeah, absolutely. Thank you for the reminder, Chair. There's a deadline coming up on March 1st as part of the EPA's climate pollution reduction grant, $4.6 billion aimed at reducing greenhouse gas emissions countrywide. Been working really hard with the state to try to, again, provide value for Washoe County. We have heard of what the state intends to move forward with as part of the implementation part of the application, which is due April 1st. From what I have reviewed as part of the PCAP, which is the planning portion of the grant, it looks really good. It provides a lot of flexibility and options that we can apply for under the grant. I will add that as part of what the state is looking to implement, we'll definitely look for opportunities that we can help benefit low-income and disadvantaged communities. I think we're still lacking a little bit in that area, so I'll continue to work with the state and see if we can address those concerns.
Very good. Thank you.
Yep.
Any questions? Okay, thank you so much. Yep. Community and Clinical Health Services. Come on down, Ms. Lisa Litritz.
Good afternoon, Lisa Lotritz, Division Director for Community and Clinical Health Services. You have my report. The only thing I would like to highlight is, well, one, thank you for the approval of we call it the 333 grant, which will support my staff that was threatened to be lost because of the clawbacks. And in this report, it does indicate that we had an increase of 69.2% in congenital syphilis from 22 to 23. So we went from 13 cases to 22 cases, which is very concerning for our community, and with HIV increase of by 37.2%. So I do thank you for supporting us, and we are continuing our efforts and working with the community on next steps. What can we do to try and work on this? But that's all I have, and I'm happy to answer any questions.
Thank you so much. Appreciate it.
Thank you.
Okay. Environmental Health Services, Robert Fida.
Good afternoon, members of the board. You have my report in front of you. In the report, I provided a detailed SB 92 update for all of you to read through. It kind of goes through the background of the law, some of the work that's currently being done. The main thing I did want to highlight from that is our staff is working with the city of Reno to put on a town hall. That town hall is occurring today at 5:30 at Reno City Council chambers. Staff will be there. They'll guide them. They'll provide information on the process. There'll be on-site translation services available for folks as well. So that way we can get these street vendors kind of on the right path and permitted. So. Some other highlights I wanted to mention was our food program was awarded the food mentorship grant again. This time we have 3 different health departments that we will be assisting: Yolo County, Detroit, and Northern Mariana Islands. So, and some good news as well. Additionally,
Did you say Yolo County, like you live once? YOLO?
That's the best way I can pronounce it, unless there's something else.
I just want to make sure you didn't skip over that, because you just said YOLO. That's cool. Keep going.
In positive news, we did get the certificate of authorization from the FAA last week, so we actually do have that in hand now. So now that all that's left is to work with risks, make sure we're adequately covered. So we're hoping that we can get all those pieces ironed out in time for this coming vector season. So, and then the last thing I wanted to highlight was a lead and copper rule training that was provided at NMPH by our safe drinking water staff and RCAC, the technical assistance provider from the state. They had, I think, decent turnout. Over 30 people attended for this lead and copper training, and this relates to some changes in the safe drinking water that public water systems need to do a inventory of any lead and copper service lines that they have. So that is kind of all I have for my update. I'm open to any questions you may have.
I think my one question, just for all of us, you said if there's a change in some of the things, does that mean you need to work with some of what we're putting out? Is there some new regulations that are going to be started hitting, and are we helping to explain those? Or do they not really affect
for the lead and copper rule? Yeah. So it's a new federal regulation that came down. I believe it was from the post-Flint crisis. There was a lot of lead and copper service lines still in service. So the EPA required that public water systems go out and have an idea of those. So they would have to inventory those lines and then put it on a kind of a replacement plan on when they would bring those lines out of service. So, and that's kind of this is, I think, the first year that it's kind of being implemented, and people are kind of like seeking guidance. So.
Okay. Thank you. I'm interested in more of that, but thank you.
Yeah.
Yes.
Thank you, Mr. Chairman. I just wanted to, if you can extend the thanks to staff who attended the meeting via Zoom regarding the Sun Valley community cleanup that's taking place this spring. I'm really excited to get that off the ground. So tell them thank you on my behalf.
Will do. I'll let them know.
Anybody else? Okay. Epidemiology and public health preparedness with Dr. Nancy Dow. Come on down.
Good afternoon, Mr. Chairman, members of the board. Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So you have my report, nothing to change or add there, just a few recent highlights for this month. So in healthcare preparedness, as part of the fiscal year 2024 top priorities identified by skilled nursing, memory care, and assisted living facilities in annual workshops, the creation of a short 10 to 15 minute video about the mutual aid evacuation agreement was pointed to as a useful resource that could be created for just-in-time training for staff and as part of onboarding processes. So collaborative efforts between ICC members have allowed for the development of this community resource. So the participation, so with the participation from coalition members and NMPH communications and preparedness staff, this video will be filmed and worked on tomorrow at the Life Care Center of Reno. And upon completion of this video, it will be shared with coalition members to improve community resilience and response efforts. And then in emergency medical services, back in April 30th of 2023, a data sharing agreement was created between the EMS Oversight Program, City of Reno, City of Sparks, REMSA Health, and Truckee Meadows Fire Protection Agency. And the creation of this data sharing agreement provides for easier sharing of data between agencies in order to support needs and quality assurance and improvement purposes, and for the program mostly to provide secure access to data. So the final piece to this agreement required a secure file transfer protocol site to allow for the exchange of data specific to the signed EMS data sharing agreement. And Washoe County Technology Services has worked and helped us with an external vendor to implement this SFTP site. And as of this month, it is now officially up and running, so allowing for agencies access to upload or download files securely without barriers. So that's great news. And then finally, shifting to updates in EPI on influenza-like illness activities, ILI has been continuing to decrease, now below regional and state baselines. Similarly, RSV numbers and flu hospitalizations have also continued to generally trend downwards. So all good news here, and I'm happy to answer any questions you have.
Yeah, we like when you have good news. We don't like when you have bad news, so that is good. Thank you. Any questions? Thank you so much. District Health Officer Dick, it's your time.
Thank you, Mr. Chairman. On communications, last night I did an interview with Ariana Bennett for her Face the State show, so that'll be airing this weekend. She had another guest, so only got half the show. I think I'm on the front end of it, though, if anybody catches it. And then wanted to highlight on our cultural competency, DEI-CC training, that we've completed the project with the Larson Institute for training in public health, DEI, and equity. That is a asynchronous training, so it's available online. It's not only designed for our health district employees, but for public health agencies across the country that could take advantage of this. So it's 1 hour modules. 6 of them will have new employees take the training and encourage existing employees to explore the training. And then I did mention already that the governor had included in his 3-year strategic plan that dedicated funding for public health. I provided a little bit more information about that. There's limited information available. The Nevada Independent became aware of a presentation about the plan. I haven't actually seen the full written plan, but my understanding is that Allison Genko was instrumental, the governor's public health officer, in having that included, and also wanted to acknowledge the outgoing chief of staff, Ben Kiekeffer, for his work to have that included within the 3-year plan. So it's great it's in the plan. Now our work is to try to work with the governor's office and others to make it a reality. That concludes my report.
Any questions?
Any questions?
Very good. Okay, we're moving on to board comment. I have 2 quick ones just for all of our board members, next month will be our meeting will be pretty important. Hopefully, we can have most of us in person because we're going to be doing our interviews, and so want to make sure that's there. We will be having a 12:30 attorney-client ahead of time, just 30 minutes ahead of time, so we can go over the process, so we can ask questions amongst ourselves at that moment before we come in, and so we look like we know exactly what we're here to do, and that's what that'll be about. No other conversation. And then I do want to officially welcome back Commissioner Mary Luz Garcia. Thank you for sticking around. So we appreciate that, and yet another couple of years to hang out with us. I think it's fantastic. So with that said, that's all I have to say. Any other board comments? With that said, we are officially adjourned. Have a great day.